Now this is the time to welcoming our that participants once again, and it is my pleasure to introduce our distinguished speaker. So my next speaker is Dr. Nimitha K. Mohan. So she is the MD and DNB microbiologist and MNAMC CICP consultant clinical microbiologist and ICU in Aster Medcity Kochi. Former demonstrator at Government College, Chandigarh, and former assistant professor at Amrita Institute of Medical Science, Kochi. So over to you, sir.
Good afternoon, everyone. So now, today I'll be talking about, in a nutshell, I'll be giving a brief on the employee vaccination, which are the mandatory ones according to the rules and laws, and which are the optional ones, and what is the impact on a healthcare setting. So this is the scope of my presentation. I'll be covering all these topics in a nutshell. So why the vaccination matters for healthcare workers is our first question. So you know the healthcare workers, we the healthcare workers are at a higher risk of contracting infectious disease. Maybe it may be directly or indirectly with during the patient encounters or patient fluids, body fluids, or any contaminated surfaces. So it is the optimal use of vaccine that will break or prevent the vaccine preventable diseases and eliminate unnecessary work restrictions. Moreover, it also protects the patients, that is the vulnerable. If a healthcare worker is being vaccinated, it will prevent or break the chain of transmission of vaccine preventable diseases to vulnerable patients. Then it also promotes public health. That is, the healthcare workers are the community role models. So we are taking vaccination. That means that will also promote to the broader public health initiative. This is important, especially during the epidemic or pandemic scenario. And then this vaccination also prevents the outbreaks in the healthcare settings to a larger extent. So this is a cycle. That is, the vaccination is a cycle. That is, it prevents the vaccine preventable diseases from the healthcare worker to the patient, from the patient to the healthcare worker. And the third one in the cycle is the after the exposure to such a scenario. So we'll discuss each one. So I am dividing the healthcare worker vaccination according to the healthcare organization. We have multiple healthcare organizations, that is the Ministry of Health and Family Welfare, FSSAI, Central Pollution Board guidelines, WHO, etc., etc. So according to this healthcare organization, the healthcare vaccination I have divided for easy understanding into two sets. That is, one is the mandatory vaccination to the healthcare workers according to the rules and laws. That is, without these vaccinations, it is difficult for the healthcare worker to work in a healthcare facility, or it has like penalty to pay for it. These are the mandatory vaccines which are given to the healthcare workers who are handling the biomedical waste and the healthcare workers who handle the foods in the facility. The second set is the optional vaccines as per the guidelines and best practices. There are certain vaccines which are listed according to the guidelines, and not everyone is mandatory. All the vaccines are not mandatory, but if we give the set guidelines, that is our best or good practices. So in a nutshell, the mandatory vaccines which should be given to the biomedical waste handlers is one is the hepatitis B and the tetanus. This should be mandatorily given to the staff handling biomedical waste. Second one is the food handlers. There are two vaccines apart from the hepatitis B. There are two vaccines which should be mandatorily given to the food handlers. That is a typhoid vaccine in order to prevent the outbreak of typhoid, and second one is the hepatitis A vaccines, which is also given in two dose series, which gives a lifelong immunity. Other vaccines which can be thought of or which should be given for the food handlers are the cholera vaccines and the tetanus vaccine. But these vaccinations are recommended depending upon the region of epidemicity or endemicity. Next is according to the accreditation bodies like your NABH, your JCI, your NABL. There are certain vaccines mandate for the healthcare workers, all the healthcare workers. That is, hepatitis B is mandatory for all the healthcare workers according to the accreditation bodies. The other optional vaccines, depending upon the guidelines and best practices, are the influenza vaccine, MMR vaccine, Tdap, and varicella vaccine. Then the vaccination strategy for healthcare workers category as per risk and regulations. That is, we have discussed for the biomedical waste handlers, food handlers. Now it is the BMSTU oblique the SOTU staff. That is the staff who is working in the transplant units. Why this is important? Because the patients admitted in such a scenario are highly vulnerable or immunocompromised patients. So it is a mandate that we have to break the transmission of vaccine preventable diseases from the healthcare workers to such patients to avoid possible serious consequences in such patients. Such vaccines of high priority are varicella, MMR, and influenza vaccine, apart from the other vaccine, that is hepatitis B, etc., that I'll be discussing later. And then the vaccines for this category, which can be thought of, or if it is given, it's a good practice, is Tdap vaccine. So one by one, we'll go through the vaccination schedule. First is the hepatitis B vaccine. So all the healthcare workers at risk of exposure to blood and body fluid should be given the hepatitis B vaccination. It is given normally in 3 doses, 0 dose, the first after 1 month and after 6 months. So the timeline for the protective antibody, complete protective antibody to develop is after the 3rd dose. So this is checked by checking the anti-HBs titer probably after 1 to 2 months after the 3rd dose of vaccination. Here is a small note. I told a scenario that is patient to healthcare worker. So here, especially in the dialysis unit, for the hemodialysis patients, the hepatitis B is given in a high dose, double dose is given to the patients in the dialysis patient. This is to prevent the outbreak among the patients because their immune status is low, and moreover, they are more prone to get the immune mediated diseases. Next vaccine is the MMR vaccine. That is, the recommendation says healthcare worker with no laboratory evidence of immunity, either by the disease or by the initial vaccination record, should be given the MMR vaccine. So it is given in 2 doses. The first dose is administered at any time if the worker is not immune. The second dose is given after 4 weeks, and the timeline for protective antibodies is after 2 to 3 weeks of administration of the second dose, and once it is given, it is a lifelong shot. Next is the influenza vaccine. That is just prior to the influenza season starts. The annual influenza vaccine is recommended to the healthcare workers. Then single dose, it's a single dose and it is given every yearly. There are 2 formulations which comes under the influenza vaccine. That is the inactivated vaccine, which is given IM, and live attenuated vaccine, which is given intranasally. A small note here that the pregnant ladies and immunocompromised staff, etc., should receive a inactivated vaccine to prevent the complication. And the peak antibody levels are reached after 2 to 3 weeks of vaccination, and after 6 months there will be a decline in antibody. That is the reason why every yearly it should be given, and moreover the strains also will be different. Next vaccine is the Tdap vaccine, which include tetanus, diphtheria, and pertussis, or single tetanus toxoid also will do for this. A single shot of Tdap vaccine is recommended if individual have not received it previously. And every 10 years, we have to give the booster dose. And you all know that the pregnant healthcare worker will receive a shot of TT or TDAP in the third trimester. It is generally given is a single shot intramuscular, and the peak level of antibodies arises after 2 to 4 weeks after the shot. Next is the varicella vaccine. The healthcare workers who are not immune or are more prone to get the disease should be given the varicella vaccine. It is given as a single dose subcutaneously, and the development of antibodies occurs after 2 to 3 weeks. So next, after discussing the schedule of the important vaccines which is mandatory and optional, I am going into the details of the vaccination of healthcare workers in special settings. First is the vaccine for biomedical waste management staff. The mandatory ones are the hepatitis B and the tetanus toxins. The dose and schedule I have already discussed. And influenza vaccine, MMR vaccine, and varicella are optional ones for them. If we are giving them, it's a good practice. But you should at least give a shot of hepatitis B and tetanus to the such staff. Next is the vaccine recommendation for food and beverage staff. Hepatitis B, hepatitis A, and typhoid should be given on a compulsory basis to all the food and beverage staff. And tetanus, TDAP, influenza, and MMR vaccine are optional. It is a best practice. Next, the vaccine recommendation for the staff posted in BMTU/SOTU. The hepatitis B, varicella, MMR, and influenza shots should be given. That is a mandatory for such staff working there, and TDAP is an optional one. Next, I'm coming on to the guidelines on the best practices in healthcare worker vaccination. First and foremost is the assessment of immunization status. So this is the responsibility of the HR team and the staff clinic to assess regularly the vaccination status of the employee in the facility. The second one is we have to prioritize the high-risk workers. That is, we have to focus on the high-risk setting and those underlying the condition. And this is to prevent the outbreaks and to prevent the exposure to such vulnerable patients who will end up in the possible serious consequences. Next is the awareness and education. So there should be a system of continuous regular awareness programs should be there, and continuous education should be given on the risk of vaccine preventable diseases. This can be initiated by the HR, and along with the HR, staff clinic, and the infection control team, this cycle can be completed. And vaccine access and availability. The leadership, it's the responsibility of the leadership and the HR and the staff clinic to ensure the vaccines are available and accessible to all the healthcare workers, especially those working in the high-risk exposures. Then what are the recommendations for ethically implementing the mandatory vaccination program? So different hospitals will be having different vaccination program or immunization or vaccination policy. The first one is the clear and safety communications. That is, it is a responsibility of the HR and the staff clinic to clearly communicate the employee about the patient safety, and it is the responsibility of infection control team to give and enlighten the employees on the vaccine preventable diseases in the healthcare setting. The second one is to support the vaccination procedures. That is, the leadership should ensure that the vaccination is free, it is easily accessible to the employee, and there should be a comprehensive system for handling the adverse effects. Next is the transparent policy development. That is, whenever the leadership is doing a vaccination policy, it is always welcome the healthcare workers' perspective also to add on to the policy. This will in fact give a positive push for the employees to get vaccinated and thus prevent the vaccine preventable diseases. Next, there is a scenario called as the opt-out criteria. That is, some healthcare workers will have some contraindications for getting the vaccines. that is the medical exemption criteria. Sometimes the workers will be allergic, or they will be their immune status doesn't allow them to take the vaccine. So these are called as the opt-out criteria. So the opt-out criteria should be clearly defined, and if allowed, they should be transparent based on the objective reasons. Next is the alternatives for exempted patients. So opt-out, after the opt-out criteria, these healthcare workers should be exempted from the certain works. That is, the appropriate PPE should be given to them during their work inside the facility. Their assignment should be rethinked of, and they should temporary leave can be given during the peak outbreak transmission season, etc., can be thought of for opt-out criteria staff. And then consequences for refusals. There are clearly state the consequences for refusing a vaccination. That is, we can give reassignment, unpaid leave, termination, etc., are the recommendation as per the WHO. And notification for new employees. So once you are hiring a new employee, it is our duty during the induction program or whatever may be the initial encounter with the new employee to explain to them the mandatory vaccination policy and the consequences of non-compliance before the hiring itself. So this will also help the system to completely comply on the vaccination policy by the employer from the hiring itself. So these are the various recommendations for implementing a vaccination program according to this is taken from the WHO. So there are many review articles also on the implementation of vaccination program, and the employee participation in making such program or vaccination campaigns. There are multiple articles as well. Then coming to what is the difference between an opt-in and opt-out criteria? See, in opt-in criteria, it's a voluntarily the healthcare worker want a specific vaccine. And opt-out criteria, it's a mandatory. That is, the healthcare workers must vaccinate unless they are exempted. And what is the exemption criteria? In opt-in policy, there are no formal exemptions. It focuses on the education and awareness. Whereas in opt-out policy, there will be certain medically the staff will not be fit for the vaccination, like allergies, immunocompromised status of the staff, etc. And the alternative measures for opt-in policy, there are no much alternative measures, no penalties, no for non-compliance, because it's all depending upon the healthcare worker. It's their choice. And in opt-out criteria, we can give mask, then reassign to non-clinical areas. Then they can give a temporary leave for the non-vaccinated staff, especially during the outbreak season, etc. Then consequences for refusal, no penalties for opting out, and reassignment or unpaid leave or suspension can be given for the opt-out category, because they are not sticking to the alternative measures, and thereby they are putting themselves into the harm and to the other employees and work and patients as well. Then the prospective employee notification, which is optional and can be encouraged for the informed decision in opt-in category. But in opt-out category, there is must be communicated during the recruitment itself, and there is a declaration form also for this opt-out criteria, which I have posted in the right side of this page. Next is the management of opt-out healthcare workers. First and foremost is they should have a clear criteria for the opt-out thing. That is, the medical exemption and non-medical exemptions are there. Medical exemptions, that is the documented health conditions like allergies, pregnancies, immunocompromised status, etc. And in non-medical, because of some religious exemptions. So whenever they come with an opt-out criteria, they should have their local proof or evidence for that, either be a medical certificate or it can be under the local laws. Then process of opt-out request is healthcare workers must submit a formal request of exemption. Either it may be medical documentation or other religious documentation. Then alternative safety measures, that is, I already explained, such criteria of staff should be given appropriate PPE, they should be given temporary leave, their reassignment should be rethought of. Then education and counseling, that is, provide the education about the risk of opting out. This should be well explained to them, especially by the staff clinic during the admission process or the induction process. Then their monitoring and documentation should be on a continuous scale. This should be done by the HR along with the staff clinic. And the consequences of non-compliance, I already told you, the disciplinary action can be taken. Then if they are not wearing or if they are not complying to the alternative measures. Then the communication, that is, there should be it should be transparent, and the employee awareness also should be there. That is, make sure that the healthcare workers understand the reasons for vaccination policies and importance of controlling the transmission in the healthcare setting. And we have to review, regular review of policy should be done. That is, you should have a set of timeline for the policy. Maybe it is 1 year, 2 year, whatever may be, that regular revision should be there, and that should be communicated to them as well. And the prospective employees, that is, the new employees, the mandatory vaccination policy should be explained during the induction process itself. And how will you do a PEP for the opt-out healthcare individuals? That is, after the exposure, along with the source, their blood also should be sent for the screening. For HBV, in opt-in candidates, no PEP is needed if they are immune. For opt-out unvaccinated healthcare workers, initial HBIG can be considered, and HBV vaccine within 24 hours can be considered, provided the clinician has to explain to them the need for the scenario. That is very important, because they are coming under the opt-out criteria. For HIV, start 3-day post-exposure prophylaxis for 28 days in opt-in criteria. And in opt-out patients, also encourage the PEP after the consultation with the clinician and monitor if they have declined. And then for HCV exposure, no PEP available. Just we have to monitor for opt-in and opt-out healthcare workers. So what is the healthcare worker vaccination waiver process? That is, healthcare worker submits a formal waiver request. Healthcare worker must provide a valid reason for the exemption. This I already explained it in detail. I have just formulated into a flowchart format, either by medical certificate, religious affidavit, or personal statement. Then occupational health or HR reviews the request, and the decision is then communicated to the leadership. Either it will be approved or a denial notice will be initiated by the leadership. And if approved, the healthcare worker follows the additional safety precautions. So this cycle is called as the waiver cycle. Then what are the strategies for dealing with behavioral issues for healthcare workers on vaccination? That is, first and foremost is education and training. That is, providing the evidence-based information on the safety of the vaccine preventable diseases is a most important thing. And training the leaders and managers also to communicate this to the ground level is also important. The second thing is to encourage the senior healthcare workers to lead by example. If they get vaccinated, they can very well communicate to the lower staff the importance of vaccination. That is, the peer-to-peer communication is also very important to solve the behavioral issues among the healthcare workers. Then there may be certain myths on certain vaccination. That correction of the myths about the vaccination should also be addressed. And then involvement of the healthcare worker in decision making to create their own ownership and increase the participation. That is, we are compiling a vaccination policy for the facility. We can take their inputs as well. Then offer incentives or recognition of healthcare worker who get vaccinated. You can give them a promotion in this way. And then customize the communication channels to specific healthcare worker group based on their roles and concerns. This is called as a tailored communication. And finally, to establish the strong policies that promote the vaccination among the healthcare workers. Our vaccination policy should be strong, and the facility should comply to the policy, and the HR staff, clinic, and the infection control and the leadership cycle should ensure this is complied to. Then what are the strategies for monitoring vaccination in healthcare workers? How do you monitor it? You have implemented a vaccination program. Now it's our duty to monitor it and take it a long way. So first and foremost is the data collection and the surveillance. That is, we should have a robust system inside the facility in the place to track the healthcare workers' vaccination status and identify the gaps and monitor the coverage. This comes from the HR and the staff clinic. Second one is the routine monitoring. Again, the regular accessing. You have a yearly checkup. During the yearly checkup, it's the HR and the staff clinic should sit and sort out for the vaccination, routine monitoring of the vaccination as well. Then addressing missed opportunities. That is, identify and act on the missed vaccination opportunities to improve the overall coverage among the healthcare workers. That is also important. And then the feedback also should be given to the healthcare workers and continuously improve the vaccination strategies as well. And integration with national immunization program. Your facility can get integrated with such programs so that this is a cycle which will be continuous, and there will be no, you will have reduction in the non-compliances of the vaccinations. So finally, the message to take away is vaccination ensures a safer healthcare environment and reduces the risk of disease transmission. We have to focus on the healthcare workers posted in the high-risk areas in order to prevent outbreaks. The monitoring and compliance to monitoring and vaccination is very important, and especially you should be compliant, the facility should be compliant to the national guidelines as well. Regular tracking through health institution is necessary to improve the coverage, and somehow educating, training, and peer influence will help addressing the vaccine hesitancy among the healthcare workers. So vaccinate to stay healthy, safeguard patients, and prevent the spread of vaccine preventable diseases. Thank you.
Thank you, ma'am, for your nice presentation.